Hi, good morning. This is Dr. Buvaneswari. I'm going to say a few words about laparoscopy. Laparoscopy is nothing but endoscopy, which is passed through your abdominal cavity to see the reproductive organs, mainly gynec endoscopy. In that, what are the reasons? Mainly to see whether your tubes are okay, your uterus is normal sized, and your ovary is not having any cyst or anything, endometriosis or any pelvic infection additions. These are the common findings we'll be seeing, so we'll rule out all those things. And also we inject a dye to see whether your tubes are patent or not. This is the main reason we go for the laparoscopy. There is a repeated laparoscopies we have seen in some patients for two reasons. One is that fibroids repeatedly operated. Second one is endometriosis, which is the commonest surgery in the gynecology, because endometriosis is a recurring disease, so it needs a laparoscopic correction. If they don't do it in the first sitting properly, they may develop recurrence within 6 months. Then they keep on going for the laparoscopy. Nowadays, because of the advancement of technology, in GBR also we have a high-end HD and 3D cameras where we will be able to see very easily and do it as a daycare, and you will not have any pain. So morning you can come without eating anything with our instructions and then get the surgery done. By evening 5 to 6 o'clock you can get up and go home. So this is what we generally do. All these laparoscopic surgeries are very safe with the experience. Since we do regularly a laparoscopy for infertility reasons, gynecological reasons, uterus removal, and nowadays we are even getting trained for robotic surgeries where any difficult cases also can be done as a daycare procedure. So post-op complications for laparoscopy is very less, and most of the time very minimal pain where we have a suture the skin. The skin incision also is very small, 5 to 6 millimeters only. You won't even know that there is a stitch inside, and we'll be putting stitches which can fall up by itself. You don't need to remove, or sometimes for the cosmetic purpose we can use clips also. These are the main things, and infection rates are very less. Again, along with the laparoscopy, we may do hysteroscopy to find out whether the cavity is alright or not, and whether your tubal opening is correct or not. So through hysteroscopy also we can do procedures like tubal cannulation, where we can remove the tubal block. The second one is polypectomy. Any fibrous which is pushing inside the cavity, we can be able to remove that through the hysteroscopically. Any septum, congenital anomalies, we have released so many cases, and people have conceived with the pregnancy losses. People who have multiple abortions or pregnancy loss, these procedures will help them in having a good healthy pregnancy and term. Okay, so there are so many good things about this hysteroscopy and laparoscopy. Though it is a very simple procedure as a daycare, it can give you a lot of relief and symptoms free, and also the outcome is very good. We have seen success rate is very good after our surgeries. It all needs a good team of doctors and experience and skill of the surgeon, so which we are experienced with. So I am sure if you have any of these issues, GBR can give you a complete solution and give you a safe procedure. Thank you.